That's why continued strength work after formal physical therapy ends is often essential. Muscle and tendon timelines don't stop simply because supervised visits end, and ongoing progressive loading plays a key role in long-term success. Are you ready to get back to what you love after knee replacement? The Total Knee Success podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success podcast. I'm Michelle. When someone asks me how long it takes to heal after a knee replacement, I usually tell them that most people are looking at a general timeline of about 6 months to a year. A large portion of healing and functional improvement tends to happen in the first 3 to 6 months, with progress continuing more gradually as you move toward the 1-year mark. For many people, that can sound like a long time, especially when they're eager to get back to the routines and activities they enjoy. Some surgeons do quote shorter timelines when they're talking about pain relief, incision healing, or returning to basic daily activities, and that can be helpful for framing the early recovery. Not all surgeons do this, though. Many surgeons I work with regularly talk about recovery as a 6-month to 1-year process, especially when they're thinking about strength, endurance, and long-term function, rather than just pain control. What's important to understand is that different tissues heal on different timelines. As a result, function often improves noticeably early on and then continues to build more gradually over the rest of the year, which is a normal and expected pattern. The knee can appear mostly healed on the outside, even when important healing is still happening underneath. That isn't meant to be alarming. It's simply a reminder that healing continues on the inside, even after the incision looks mostly healed. And that ongoing healing helps explain why strength, stamina, and ease with everyday activities keep improving over time. By the end of this episode, you will have a better understanding of tissue healing timelines after knee replacement. Before we get into timelines, I want to be clear about one important thing. Healing after knee replacement is individual. The time frames we'll talk about today are typical biological ranges, not promises, and they won't be exact for everyone. Your own healing is influenced by factors like your overall health, the specifics of your surgery, and how your recovery unfolds over time. That's why it's always important to talk with your surgeon and your care team about what these timelines mean for you. After knee replacement, different tissues heal at different rates. Current research allows us to describe these timelines in realistic ranges rather than vague milestones. While there is always individual variation, the underlying biology tends to follow predictable patterns, and those patterns help explain why recovery feels faster in some phases and more gradual in others. Certain medical factors can shift these timelines. Conditions such as diabetes, vascular disease, chronic inflammation, and reduced preoperative strength are consistently associated with slower recovery of strength and function. Postoperative complications, particularly infection, can significantly alter healing trajectories and often require a very different rehabilitation course. For most people without these complications, which is most people, healing still progresses within predictable ranges. It's also important to understand that a small percentage of people develop excessive stiffness or scar tissue early in recovery, sometimes referred to as arthroplasty. Large studies suggest this affects only a minority of patients, often estimated in the range of just a few percent. Definitions vary somewhat across studies, but when problematic stiffness does occur, it's usually identified early and addressed with targeted care. For the vast majority of people, gradual stiffness early on reflects normal healing rather than problematic scarring. With that in mind, let's walk through tissue healing in the order supported by current evidence, from the shortest to the longest biological timelines. Skin is the first tissue to heal and the most visible. The surgical incision typically closes within 2 to 3 weeks. By about 6 weeks, the skin barrier is healed in most patients, and the scar then enters a maturation phase that can continue for 6 to 12 months. There's a meaningful early window for scar care. During roughly the first 6 to 12 weeks, the scar and underlying tissues are more responsive to gentle movement and mobility work, aimed at reducing adhesion and excessive thickening. After this period, scars can still change, but improvement tends to be slower. What skin healing tells us is simply that the body has sealed the surface. It does not reflect readiness for unrestricted loading or high-demand strength work. Bone healing comes next. After a knee replacement, the implant is usually mechanically stable early because it's fixed to bone using cement or a design that provides immediate structural rapport, allowing immediate or early weight bearing. Biological bone healing, however, follows a longer trajectory. Osseointegration and bone remodeling often occur over approximately 3 to 6 months, with continued adaptation extending toward 12 months as bone responds to new loading patterns. This prolonged remodeling does not mean the knee is fragile or at risk when you are following your surgeon's and therapist's activity guidelines. It simply reflects how living bone adapts over time to new mechanical demands. Tendon healing and adaptation occur on a longer timeline than many people expect. Tendons transmit force from muscle to bone, but they have a relatively limited blood supply, which means they remodel more slowly than muscle tissue. Early adaptation often occurs near the muscle-tendon junction, where circulation is better and function can improve within the first few months. In contrast, the mid-portion of the tendon and the tendon-to-bone interface adapt more gradually. Current connective tissue research suggests that while tendons begin responding to load early, meaningful structural remodeling and load tolerance typically evolve over approximately 6 to 12 months. And this helps explain why tendon-related stiffness and soreness may appear later in recovery as activity levels increase, even when overall function is improving. Muscle recovery is the longest and most rate-limited aspect of knee replacement healing for strength, endurance, and higher-level function. Although muscle tissue begins repairing immediately after surgery, meaningful restoration of strength, stamina, and neuromuscular control typically takes about 6 to 12 months, and in some cases a bit longer. Quadriceps weakness is particularly persistent. Longitudinal studies show large strength deficits at 3 months, clearly measurable deficits at 6 months, and incomplete recovery in a substantial proportion of patients at 12 months. Don't you want to get all your strength back? Strength and functional capacity often continue to improve well beyond typical outpatient discharge times, and this prolonged muscle recovery is driven by more than tissue repair alone. Swelling, pain history, altered gait patterns, and ongoing neural inhibition all suppress muscle activation. That's why continued strength work after formal physical therapy ends is often essential. Muscle and tendon timelines don't stop simply because supervised visits end, and ongoing progressive loading plays a key role in long-term success. Surgical technique can influence early muscle recovery. Muscle-sparing and minimally invasive approaches are designed to limit quadriceps disruption and preserve early neuromuscular control, which can improve short-term activation and early function. Long-term outcomes, however, consistently converge regardless of whether a minimally invasive or more traditional approach is used. Even with muscle-sparing techniques, full muscle recovery still unfolds over months rather than just weeks. After total knee replacement, ligaments are often less important to discuss than people expect. In many knee replacement designs, some of the native ligaments are removed, substituted, or mechanically balanced by the implant itself. Which ligaments are preserved depends on the surgical technique and implant design. So ligament healing is not a uniform process across all patients. The joint capsule, however, plays a much larger role in recovery. The capsule is incised, which means it's cut, stretched and repaired during the surgery, and it surrounds the knee joint, contributing to motion stability and the sensation of stiffness. Capsular tissue remodels gradually in response to movement and load, and this process typically unfolds over approximately 6 to 12 months. Ongoing capsular adaptation helps explain why stiffness after sitting, tightness at the end of motion, or the feeling of resistance with deeper bending can persist well into the first year and then slowly improve over time. When these timelines are lined up, the sequence becomes clearer. Skin heals in weeks, bone remodels over months. Muscle recovery often takes 6 to 12 months or longer. Tendons adapt gradually across similar time frames. If there are only a few things I want you to remember from today, it's these. Skin healing does not mean the knee is ready for full demand. Muscle recovery is usually the slowest part of the process, and deeper tissues are still adapting long after the incision looks healed. That's why recovery works best when it's treated as a process rather than a race. Staying engaged in rehabilitation, continuing progressive strength work beyond formal physical therapy, and following up with your surgeon as recommended all play an important role over time. In an earlier episode, episode 40, we talked in more detail about neuromuscular electrical stimulation and how it can support early quadriceps activation for some people. If that topic is relevant to you, I encourage you to go back and listen to that episode. Knee replacement recovery is much more like a marathon than a sprint, with steady, consistent effort leading to the best long-term outcomes. In episode 44, coming up this Friday, we're going to talk about why being cleared, quote-unquote cleared by your surgeon, doesn't mean you're done healing, and what those surgical milestones don't tell you about how your knee continues to adapt over time. If you're preparing for a knee replacement and want a clear, grounded way to use the weeks before surgery to set yourself up for a smoother recovery, my upcoming book, The Total Knee Replacement Game Plan, will walk you through exactly how to do that. It's educational in nature and meant to complement, not replace, the guidance of your healthcare team. We'll discuss how to go into surgery informed, not overwhelmed. You can click the link in the show notes to get notified when the book is released. Remember, this is a long-term process. Steady effort, patience, and consistency add up. And the work you put in now supports how your knee will serve you for years to come. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.